Okay. All right, I am live. Ask Dr. Jay-Z, Dr. Jack Zamaris. How you guys going on Wednesday night? No, where are we? Tuesday night. Tuesday night, I don't even know what, 29th of May, last week of autumn. It's winter on Friday. Hope you guys are well. Jack Zamaris from Artiste Plastic Surgery, and I'm here joining you on Plastic Surgery Hub's, Plastic Surgery Hub's, the Plastic Surgery Forum, which essentially is called Plastic Surgery Forum for Aussie Chicks. That's the one. So I'm sure you're all Aussie chicks out there. You can see I'm in my personal study. I'm just having a look at the background there of my bookshelf. It looks a bit messy, so apologies for that, guys. You can probably see my son in the background. I just got home from work an hour ago, and he's probably wondering why I'm not playing with him. He loves playing dinosaurs, and he might pop in, say hello, show us his pterodactyly and his Spinosaurus. I'm sure he will. So excuse that mess. Didn't get a chance to clean it up. That's my wife in the background up there. You can probably see some of my book collection there, which is not really a lot. Mainly it's just travel books. But I'm reading a few books right now, which are pretty good. So today we're going to talk about basically facial surgery, and in particular facial plastic surgery. And we've had a lot of questions up until, hey Trish, thanks for having me on. And we're going to talk about face and neck lift, and I've got I haven't counted them. I've got a page load of questions once I get my my words out on face and neck lift, which I'll ask, and feel free to ask anything while we do it as well. So Trish, is it okay in terms of the orientation that I have this camera on? Because I have this setup is in my study. So normally when I do the live, sometimes I do it in here, but sometimes in the office, obviously. So for those of you that don't know me, I'm a plastic surgeon from Sydney, and excellent. So I'm a plastic surgeon from Sydney. I've been in practice for about 6 years. Hi, Adriana. About 6 years now, in my private practice for 3 years. So after I finished plastic surgery training, I worked for 2 years in New York and Paris, and mainly in facial surgery, so reconstructive and mainly cosmetic face, and worked with all the big names in New York, Paris, and specifically also San Francisco and Miami. So, and I basically more subspecialize in a lot of facial procedures. So I think we should just kick right into it, don't you think, Trish? And start answering some of the questions. And if anyone comes on and has other questions, happy to answer them and address them as well. And if there's time, but the lighting's probably really bad because I'm fortunate enough to be able to see vivid Sydney from here, the lights. So I might be able to give you guys a sneak peek later on. Excellent. All right, so here we go. First question I had was, how do I know, which is a really good question, because when you talk about the face, people often separate the eyes, the brow, face, and neck. First question was, how do I know if I need a neck lift as well as a facelift? How much does a facelift without a neck lift, I guess it means? How much does a facelift without a facelift help the neck area? So I think the question is how much does a facelift affect the neck area if you're just doing the facelift alone? So look, the answer to that question is, it's my job to sort of advise you on that. So it really doesn't really come down to, do I need a facelift, do I need a neck lift? It comes down to what really bothers you the most. Because often, I'd probably say 50% of my patients do call in, book for a facelift appointment. And sometimes it's more neck or more voice, but they'll use the term facelift to go for the whole face. But some patients will not necessarily use those terms. I'll talk about problem areas. So hi Chloe, to put it from another perspective, when you're doing a facelift, you're often, as a plastic surgeon, technical side, you're often thinking about this area here. And when you're doing a neck lift, you're talking about here. But there is some overlap, obviously. And when you're doing a total facial rejuvenation, you're talking about the brow, eye, as well as everything. So, but a lot of people use facelift as an umbrella term. So the short answer is, if you're doing a facelift and a full facelift, then you do help the jowl and the neck. How much you help the neck is probably about 20%. So it affects 20%. The way I look at it is I do some of the questions we'll ask later on in terms of what I offer facelift wise. But if you look at 3 major facelifts that you can do, is you can do a short scar facelift, full facelift, and a full facelift with a neck lift. So what a short scar facelift is an incision in front of the ear, and what that does is it addresses the jowl. It's essentially a lower facelift. Hi vet, when you're doing a full facelift incision, you're going behind the ear as well as the front. So you're helping the jowl as well as the mid face, and you're tightening the neck from this side. But the neck's also got a lot of things here. So the neck has a muscle here that you can tighten, also has submandibular gland you can actually trim, and a lot of neck work you can do. So while a full facelift will affect the neck only by 20%, but it will still give you a nice neck contour. And if you go to my website, artisteplasticsurgery.com.au, under neck lift or facelift, you'll see that the facelift, patients that have had facelift alone, it does affect the neck. But I'd say 20%, because the next operation is to do a full face and neck, and what that does is it actually allows you to work here as well, and you get a full facelift. Hi Sharon. So just to summarize the question, a lot of it depends on what you want. So if you're mainly complaining about double chin, really strong jowls, and actual platysma bands where you've got bands in your neck, then you need a neck lift. If you're more thinking you've got lower jowls, that's more face, but there is a crossover with neck. So the question is, it depends what area you're more focused on the face, whether it's your neck or your jowl or your upper face. And the second part of the answer to that question is about 20%. So a full facelift incision will help the neck 20%. And that's about it. So I hope that answers the question, whoever asked that. All right, cool. So the next question is, what do you suggest for really bad jowls? I hope this sounds okay. Let me know if it's not. And then the second part of the question was, I don't want to have a facelift and all the scars if there is any other options. Is it the only realistic option, in other words? But it is the only option. Is it the only option, really? Look, if you've got bad jowl, so the jowl, for those of you that don't know, is just here. So in someone that's aging, what happens is you have the facial ligament that attaches here, the mandibular ligament, and what happens as you age, and I'll push my face down here, you start getting jowling. So it's basically this area here. And the reason for that is the upper face falls down on the ligament, and you get this thick area of skin here, and it almost drops into the neck. So that's what the jowl is. Look, the unfortunate thing is, for this question is, the only real way to address it, especially if you say you've got bad jowls, is to do a facelift. And the reason for that is you need to reposition the ligament up here. And you can see just taking 2 fingers, gentle pressure, it just completely corrects the jowl. And that's what a facelift is powerful at doing. Now, the non-surgical modalities that are out there include filler. You can actually fill this area with filler directly on the bone, so the pre-jowl area, with like a Voluma filler, 1 or 2 mils, and that will indirectly boost the ligament. So imagine a scaffold on a construction site, and a scaffold's tilting a little bit, the ligament's falling, and you're just boosting it up with sandbags, and the sandbags are the filler. So you can help it, but it's not a long-term fix. The other things are things like thread lifts. The problem with thread lifts is they only move the skin, and this is a ligamentous issue that goes all the way to the bone. So threads don't really work, and I'd strongly advise you not to get them. So the answer to the question is, if you've got bad jowls, facelift is the best way to do it. You can temporize it with fillers. So I hope that answers that question. Cool. Okay, and another Sharon, hello. Okay, so I saw you have different kinds of facelift techniques you use. Do I pick them or do you pick them? Like, how do you know what we want? Okay, cool. Well, the reason why, I'm very old school in terms of a doctor, let alone a plastic surgeon. So you come into my office and sometimes there's a referral, sometimes there's not. And basically you tell me what the issue is, and I try and get that out of you just with our conversation. So you come with a presenting problem. I mean, occasionally patients tell me, and sometimes I find it the hardest way. They sit next to me at the during the consultation, and they actually ask me, what would you do? And I'm like, well, okay, there's a number of things I could do. What am I focusing on? But most of the time, the patient actually tells me, they're really worried that when they look in the mirror, or there's photos, that they're starting to look a little bit older, or maybe they're starting to look like their mother or their auntie sometimes, or they're beginning to notice some jowl in a photo, or hollowing of the eye. And that kind of directs me to, okay, so they're really concerned about the jowl, or they're really concerned about the lower eyelid. And that kind of pushes me to what sort of facelift they'll need. Or they're talking about this, and the neck, in which case I think, yeah, you need a full face and neck lift. So it really depends on where they're going with why they want to have surgery, or sorry, what is the main issue that they want. And that's essentially what guides me to the facelift technique. So the different facelift techniques I've got, I'll summarize them. There's about 4 of them. If you include the neck, there's like 7. So you get quite a bit. But essentially, usually I offer patients mainly two. Hi, Crystal. Usually two. And the reason for that is there's one ideal operation and the other one is an operation that will work and work for the problem. But there's always one that's probably can do a little bit more potentially to try and reduce the need of any further surgery in the next 2 or 3 years. So to summarize, I'll take a step back before I talk about the types of facelift. So I have, when you're looking at facelift, you're talking about two things. So the incision, so where you're actually making the incision for the facelift. And the second thing is what you're doing to the internal layer of the face, the SMAS, the muscle layer. So with the incision, you can either do a short scar, and a short scar is, if you follow my finger, it's along the hairline, behind the tragus, which is this cartilage noggin in front of the external auditory meatus, and then just behind the earlobe, and it stops just there. And it allows you to work on the cheekbone, the nasolabial fold, and the jowl. Now, the next thing is you can do a full facelift incision that follows all the way behind the ear and back to my hairline here. And that allows you to do the same thing up here and as well as this part of the neck. And that's a full facelift incision. And if you can combine that with the neck, then it's a full face and neck incision. So that's the approaches. The next thing is what do you do underneath to the muscle. Now with a short scar, because you're only accessing this, you can only really do a plication or SMASectomy. And what that means is you imagine a vertical blind with pleats. What you're doing is you're tightening that vertical blind to make the pleats go away. So you're doing that with sutures. So that's called a plication, or you can cut one of the pleats out and suture it together, and that's a resection. And that's what you're doing internally to pull the face. And you do that with a short scar. With a full facelift incision, my signature facelift is what the majority of plastic surgeons do around the world. I think I'm probably the only one in Sydney that does a high SMAS. Is you're doing a SMAS plication or a resection, so similar to the pleats and the vertical blinds I just described, but you're doing that with a full facelift incision, so you're going all along here. With a high SMAS, or what I call a celebrity facelift, and the reason why I call it a celebrity is because it's done by Garth Fisher, who's the original Beverly Hills 90210, and Tim Martin in San Francisco, who does a lot of celebrities. And essentially, that facelift is a high SMAS, where you're actually taking the blind off, or taking the SMAS muscle off and lifting it up tightly. And that's through the same full facelift incision. And they're the three different types of surgery. So if someone comes to me very young, 45, 50, and they've just got a little bit of a jowl, then a short scar facelift works quite well. If they're about 55, 60 and they're concerned about three things, then the options are you can do a full facelift incision and a neck if they want a neck, and you can either do a SMAS plication or a celebrity facelift where you're completely reconstructing and cutting and lifting the muscle layer. So I usually guide it based on what they can have. Cool. So I hope that answers that question. It can be a little bit confusing because I've got so many options, but I've got so many options because not everyone needs a full facelift and not everyone wants a full facelift either for that reason. And some people have less downtime. So for example, all the facelifts I offer are from 2 to 6 hours to even 8 hour surgery. So it really depends. Trish, okay, cool. There's a question from Nat. Do you do noses? Yeah, the question is, I do noses. Hi, Amber, how are you? So yeah, so outside of face and neck lift, my favorite operation is rhinoplasty. If you look at my raw numbers, probably the most operating I did last year, 2017, was rhinoplasty first and then facelift second. But in terms of what I prefer to do, I'd rather do a face and neck lift. But I do like doing rhinoplasty surgery as well. But I like doing a face and neck lift. So yeah, so with rhinoplasty, I often do revision rhinoplasties where I harvest rib cartilage. So the short answer is yeah, I do noses for sure. All right, so let's go to the next question. On the group before, a lady posted that you can have liposuction and even liposuction fat into your face, sucked out and put into your face. Is this something you do? Yeah, look, absolutely. If you look at my facelift menu on the website, with all facelifts, apart from someone who maybe has got like a round face or a face that's already puffy and have got just mainly heavy jowls rather than lost volume, in probably 90% of the faces that I do, I always inject fat. And the reason for that is quite simple. So I'll take a step back. So the anatomy of the face consists of layer one is skin, then you got a bit of fat, then you've got your muscle layer, the SMAS, and you've got ligament, nerve, and then you've got bone or deep tissue, depending on where you are. So there's bone in the forehead, bone in the cheek, bone along the jaw, but deep tissue here and deep tissue here, the deep fascia, and ligaments connect all this together. So when you age, the ligament attenuates, so it becomes a bit looser, the skin moves, and the fat moves down as well. and the bone itself that the ligament holds recesses, so everything kind of falls. But in some people, it happens at different rates. So some people might lose volume more than others. So it really depends on the assessment on the face. So almost routinely, I always do fat grafting around the temples, because you'll notice people that age get a bit skeletal around that area, and even like young people, I wouldn't say I'm young, but like you get thinner skin around here. And I certainly fat graft that area, and also the genomandibular area where the jowl is, to help boost the bone there. So they're two areas I always fat graft in a facelift. Depending on what the patient is like, I also fat graft the lower eyelid and cheekbone. So when I do facelift surgery, unless I'm doing just a short scar, I never actually do lower eyelid surgery, because I don't need to, because the way I put my internal work is I actually lift the lower eyelid as part of the facelift incision. So the answer to the question, I always do liposuction, but it's not so much liposuction. I more harvest fat through liposuction to get enough fat for the face. So unless the patient wants liposuction to a certain area, I just do enough liposuction to get the fat that I require, and I usually process that with a centrifuge and then use an adenizer, which breaks down the fat to micro fat grafts as well as nano if necessary. I've used the nano thing only since March, so I'm still waiting to see whether it works really well, and it's really good for fine lines, but the jury's still out on it because I haven't really seen the long-term results of it with fat grafting. All right, so the next question is, how much time would I have to take off work, and how long before I can go in public without anyone knowing I've had anything done? Well, look, it's a good question. Everyone heals very differently. I say to my patients, you need minimum 2 weeks off work or 2 weeks off your social life, depending on the type of work that you do. I'll just answer this question from Trish first before it moves up. So, question from now, I have a referral from a GP to see an ENT surgeon to help with my breathing. Can I change, you fix the breathing function as well as just cosmetic? Can I change the breathing function issue as well as cosmetic? Look, that's a good question. There's a lot of patients that have breathing issues with their nose. I think as a rhinoplasty surgeon, you have to have the ability to improve the breathing. So as part of a rhinoplasty, if a patient has a breathing issue, I do intraoperative techniques to help their breathing. So either a turbinoplasty, which are the internal nares that humidify air. So I either break them out the way or I actually trim them internally, and also do a septoplasty to improve the breathing, as well as do the cosmetic aspect of the nose. So it really depends on if the ENT surgeon does cosmetic as well. Some ENT surgeons don't, but what I have done in the past is some ENT surgeons that are referred to me with a patient that they've had for sinus surgery, is that they'll do the sinus surgery and the septoplasty, and then at the same time, then I'll do the cosmetic rhinoplasty. But generally speaking, if you were to come to me, for example, I would fix the breathing as well as the nose, the cosmetic aspects, as long as it's to do with just the nose. If there's sinus or adenoid issues, then I would refer to an ENT surgeon. So the question is, it depends if the ENT surgeon does cosmetic nose, but you can certainly do both at the same time, and it often is done that way. So get back to this question about time off for facelift. So yeah, I say to most of my patients 2 weeks. You need 2 weeks, and the reason why you need 2 weeks is you need the swelling to go down, and usually at 2 weeks, even if you've got residual swelling, you can use concealer. Most of the swelling in the facelift occurs around here, and especially upper neck around here, and even down towards the midline of the neck, even if you don't have a neck lift, because the blood tends to pool. You don't really get a lot of bruising around the eye and the nose like you would with a rhinoplasty. So a lot of it's really easy to conceal with a scarf, especially in winter time. That's why it's a great operation to do in winter, because you can even go out after a week and it's not an issue at all, or wear a hoodie and no one will even say anything to you. But of course, obviously, if you live in Queensland, it's probably still warm, or far north Queensland, it's still quite warm. But yeah, I'd say 2 weeks is you need. Everyone heals differently. You can use LED light treatment to speed the healing along. You can use things like Hydroid cream to help bruising, but the reality is you've got downtime because you've had major surgery. And the technique I usually use is minimal trauma, but you still do bruise because it's a facelift. And I'd say 2 weeks you need 2. Some people need 3. If you can take 3, it's better to take more. But certainly at 2 weeks, you can be social. And if anyone says, no one's really going to notice. You'll have a slightly puffier face because you'll be swollen, but no one's really going to say anything. So minimum 2 weeks for all face surgery. That also applies for eye and nose as well. Awesome. In terms of going out in public, you can go out after 4 days. You just have to wear sunglasses and a scarf, and no one will say anything. What can you do for a double chin? Would a neck lift fix that? So look, a double chin is something that I've got here. You can see kind of. So what you've got to do when you're looking at a chin, you've got to assess what's causing the double chin. Is it because they've got a weak jaw? or is it because they're a bit overweight, or they're fatty, or is it just an aging thing, they got loose skin? So they're the three things I look at. So if it's just a little bit of weight, obviously you can lose weight. The other thing you can use is you can use a fat dissolving injection called Belkyra, however you want to say it. And what that is deoxycholic acid you inject into the fat. You can actually feel it, blot it, and inject it into the fat. It takes about 6 weeks for it to start dissolving the fat, and then you need another 2 or 3 treatment sessions. So it's a long process, and it's only been out in Australia for a year, and I've had probably mixed results. So 50% of my patients have done well. It's only been a year, I've only had like 6 patients, and the other 50% not so well. And the company recommends more treatments, but the patients don't want it because it's a bit painful. So one option is to just fat dissolve injection if you've got excess fat. The other option is to liposuction, day surgery, only takes 40 minutes, and you can actually liposuck the double chin, and the skin will take up by tightening. The other option that you can do is also, if that's for the excess fat. If you've got excess skin, there's not really a lot you can do. There are some treatment modalities out there like CoolSculpt and also Ulthera. So CoolSculpt works by freezing the area, and Amber will be able to shed light on this to see how well it works, because I haven't got a CoolSculpt machine. I did have an Ulthera for a while that I was sharing with another plastic surgeon, and I had not bad results with it, but it's only a short term, it only lasts for about 18 months. So Ulthera provides energy via ultrasound to tighten that area in the neck. So they're two non-surgical, and the kind of non-surgical invasive is the Belkyra for excess fat. The other option obviously is surgery. So a neck lift will definitely fix it, because you can go in with a neck lift, remove the excess fat, but often I never really remove the excess fat. What I do is I tighten the muscle, and that keeps the fat in, because a lot of the fat sometimes is between the muscle in the midline, and by tightening it you get rid of it that way, and then pulling it up this way and can get rid of the double chin. The other thing that I mentioned in the first thing, if the cause is a recessive lower jaw, then if it's a recessive lower jaw, you can use a chin implant, and that will correct the double chin. So the options are, depends what the cause is, but the options are chin implant, also filler to some extent, but less so. So chin implant, Belkyra, surgery, and that surgery is either neck lift or liposuction. Thread lifts, again, I wouldn't recommend it. Anonymous question. Okay, I'm thinking of having upper eyelid surgery, but I have big bags under my eyes, and someone suggested to do it at the same time. What is the bottom? The eyelid. Yeah, so upper eyelid surgery is called upper eyelid blepharoplasty. Lower eyelid surgery is lower blepharoplasty. So, look, you can do them at the same time. If you do it at the same time, there's probably slightly more downtime, 2.5 weeks, more bruising. It depends what sort of downtime you have. You can do an upper eyelid surgery under local anesthetic if it's just skin only, but when you're doing fat in the upper eyelid, you really need to be asleep because you're going deeper. So it really depends how much downtime you have. Now, there are Medicare item numbers for upper eyelid if the skin touches the eyelash, so it's helpful to get a referral for that. For the lower eyelid, there's not, unless you've got an ectropion or a downward slanting eyelid. So the questions are, if you do have bags under the eyes, then it is a good idea to address both at the same time. But really, at the end of the day, it really depends on what you want as a patient. If it's the upper eyelid that annoys you most, then you do that first. If the upper eyelid and the bags annoy you just as much, then you can do both at the same time, certainly. So I hope that answers that question. So I often do them at the same time, so it really just depends. So if I'm doing a facelift though, I don't do the lower eyelid because I don't need to. But if I'm just doing eyelid surgery, then you definitely can do up and down surgery. All right. I'm just seeing the time here. 25 minutes already, wow. Okay, not even halfway through the questions, but that's all right, I'm having fun. How long does a facelift take on average, and how long will I be in hospital for? Can it be done in day surgery? And what about the anaesthetic? Is it the same anaesthetic as a full operation? Yeah, all great questions. Look, so with my facelift menu, I have 4 major facelifts. So first facelift being a short scar, second facelift being a signature, so full facelift incision with just the face, or full facelift with face and neck, and the fourth one being face, neck, and a high SMAS. So I call that the celebrity. So with the first one, short scar, that's 2-hour surgery. Can be done in an hour and a half if you don't need any fat grafting, because that's for a younger patient who's like 45 to 50, sometimes earlier than 45, that just needs their jowl corrected. So that can be an hour and a half, 2 hours. I do it in day surgery. That will be a day surgery operation under general anesthetic. Next one I do is signature facelift, so just face, so full facelift incision, SMASectomy or plication. That's probably 3 hours surgery with fat grafting, 3 to 3.5 hours, usually 3 hours. And the reason for that is I do the whole operation. I have an assistant, but the assistant just retracts. I do everything. They don't even suture. And that takes about 3.5 hours. And that's usually day surgery as well. If you're fit and well and we do the operation in the morning. If we do the operation in the evening, like late afternoon, I'd rather the patient stay at night. So it's 1 night in hospital. but it can be done as day. Next one is full face incision, like signature face mastectomy application with a neck lift. That's probably 4.5 hours. So that is usually a 4-hour operation, 4.5 hours, and definitely stay the night. And with the high smash face and neck, the celebrity facelift, that's 6 hours surgery, 6.5 hours, and that's definitely overnight surgery. I do them all under general anesthetic. I do have another facelift called the Express Mini, and that's usually for people who are 38, 45 who just got a little bit of jowl, and it's for early tightening. I do that in the office under local anesthetic, and I just do a small U-shaped incision. I only dissect to there because that's the amount of local anesthetic that's safe, and I just put a couple sutures in the smash layer to tighten that area. That can be done under local anesthetic in the office. About an 1.5 to 2-hour procedure. Maybe it takes just as long as a short scar because you're awake and we talk to you, make sure you're comfortable. So it just takes a bit longer, even though it's a lot more straightforward. If I was doing that operation under GA, for example, which you don't need to be under GA, that'd be a 20-minute, half an hour operation on each side, so like an hour, and that's all. So that's just the time zone. So another question I have from Trish: I've really set back lower jaw and would like it moved. Can you do that? Look, that is a good question. And if you're talking about moved as in having an osteotomy, so a genoplasty, that's probably the most powerful way to move the lower jaw rather than having a chin implant. So I do this surgery with a colleague of mine in Sydney who does a lot of max fax osteotomy surgeries, craniofacial surgery. So what we do, it depends on if it's just the chin and your teeth are okay, then that's really easy to do. It's an incision that goes inside your gingival buccal mucosa. We dissect the bone and we actually make cuts in the jaw with a drill, and then move the with an osteotome, we move the chin forward and place screws to keep it forward. And potentially we can also move the teeth bearing if necessary. So the answer is yes, we do that surgery. And there is an item number, I believe, for that as well. Okay, Chloe, what are the scars like for a breast lift? I know everyone is different, but roughly how long? Okay, cool. So it's a bit off center, but that's okay. Bring them on camera. Okay, let's have a look here. Okay, what are the scars like for a breast lift? I know everyone is different. Look, scars for a breast lift, we're a bit off topic, but that's okay. Look, scars for a breast lift I find heal very well. I think most scars on a breast are very forgiving, but you need to use micropore tape after 2 weeks that the wound's healed and use it for a good 2 months. And use it religiously all the time because that will just settle it down. When a scar is red, it's still remodeling, and while it's red, it will still improve, and that can be up to 2 years. So don't be concerned if it's 2 months down the track and it's still red, it will settle. If it's getting red and raised, then obviously you talk to your surgeon, and I often inject steroid when necessary. Cool. Excellent. Let's have a look here. How long after having a facelift do I see the results? Look, that's a good question. You normally can see the results pretty well after 2 or 3 weeks. Even you can probably tell straight away. I'm not sure what my wife's laughing at, Maria, there. Yeah. Maybe you can enlighten us, Maria. Just tell me, because I'm confused now. Can you see me on camera? Can you not see me? You've got to come in. Maybe you should come in and talk to me. You're just in the other room. Anyway, so look, I often take a photo on table to show patients when I've done one side and not the other yet, so you can see the dramatic difference. You can kind of tell, patients can tell that they look different even though they're swollen, but you don't really see. Like, for example, I don't really, like if I had to show photos, I wouldn't really, might have been a random boob question, yeah. Oh, that was Nicholas. So that was my son playing dinosaurs. There you go. I reckon it was her. She's just blaming Nicholas. Anyway, I'm off track now. What was I talking about? Oh yeah, when you're gonna look at the facelift and how it's gonna look. Good question. Look, like I said, I take a photo right away, and you can see the difference. And most patients can see even within the swelling. But what normally happens is that after about 6 weeks, you can probably, if you wanted to put a before and after on your website, you probably could, but it's probably still swollen. So it takes a good 6 weeks for you to really see, but you can tell straight away, much like a rhinoplasty, you can tell the difference with the contours and things like that right away. It's just that until the swelling goes down 6 weeks, and you're not really going to see things for 3 months and 6 months, and at 6 months when all the swelling's down, you'll really see the difference with the result, but you can kind of tell straight away, which is really good. So that's a really good question. All right. I've heard to get the best facelift results, you should have IPL or heat light before and after your treatment. No, to get the best facelift results, you've got to see me. No, that's fine. Okay, do you recommend these treatments to your patients or offer them as having a facelift? Look, that's a great question. Like, I'll be honest, with intense pulse light, I don't have one, but there's nothing wrong with getting intense pulse light. I think anything you do to your skin before a facelift is only going to help. It's not going to be detrimental. I don't think it's necessary that you have skin treatment before. I think certainly after it's important. As part of all my facelifts, I do a chemical peel with trichloroacetic acid, either 25% or 40%, depending on your skin. And I also do dermabrasion around the vertical lines around the lip, because that's the only modality that works. Hill light, which is just an LED light, works really well as well. I don't really do hill light before, because the ideal time to do hill light or LED light really is 1 or 2 days before the surgery, and just logistically it's hard to do that. Eventually, when I have maybe my own operating facility, I'll do that because I think it's quite helpful. I do have a radiofrequency needling, and what that does is it causes collagenesis within your skin, and it's really good to use around here before you're doing a facelift and in the skin. And I certainly would recommend that before and after. Even like laser, like a Fraxel laser, whether it's erbium or carbon dioxide laser, I think that's good to resurface the face either before or after a facelift at all. So my recommendation was you just use your normal skin routine. Certainly if you've got access to a hill light, it's good to use 36 hours before the surgery. An IPL laser or radiofrequency needling is good to rejuvenate or just to stimulate collagenesis in your skin. But for things that are more intense, like the laser or using radiofrequency needling, you'll do it at least 6 weeks before the surgery. You don't want to do it too close because your pores will be open for 72 hours, and it takes about 4 weeks for your own body to start laying down collagen anyway. So you want to do it 6 weeks before and then 6 weeks after. So absolutely, that will definitely help the facelift results. Because I say this to people, and I know it sounds a bit tacky, but you can have a Ferrari or a Porsche. You can make the face kind of look like a Ferrari or a Porsche in terms of making it nice sharp borders, nice contours. To actually get the final result, you've got to clean the dirt off and polish it and clean it and maintain it. And it's like having a nice car that's dirty. So you still got to maintain that ongoing. But a facelift itself, you can do it on terrible skin and it will still look good. But then to maintain the actual quality of the skin, then you do need to work on the skin as well. I totally agree. All right. We've got 3 more questions to go, unless you guys have more questions. How are we going? 33 minutes. All right, well, that's pretty good. I was expecting to be on here for about 45 minutes, so that's probably about right. Okay. I'm really worried about the facelift not looking natural. Don't worry. It will look natural. Hi, Margaret. How do I know I'm not going to look different but just refreshed? Look, I mean, it's a realistic concern to have, especially as you see a lot of bad press out there about plastic surgery, facelifts, people having really pulled looks and things like that. But I'll premise this by saying that most of the images you see online, social media, even on TV, that have had overdone work, a lot of it's not plastic surgery. It's done by people that aren't plastic surgeons, like having overdone thread lifts, having like 6 mils of filler in each cheek, and they look like chipmunks basically, where they've got no wrinkles, but they just look like they're like this, and it just looks bizarre. A lot of that is not facelift. In terms of what facelifts used to be, like even though the SMAS, the muscle layer of the face, was invented in 1976, sorry, not invented, founded and described in 1976, it wasn't until the late 90s that plastic surgeons started to embrace doing a SMAS facelift. A lot of plastic surgeons, there's still some today, still just lift the skin. Hi, Rihanna. And if you just lift the skin, it does look a bit overdone. And the reason why you can get that is you get the washboard look, you get a line along just below the cheekbone, and that's what thread lifts do. Because you're lifting the skin only, you get that little line as well, and sometimes it can pucker, which is terrible. So in terms of the actual facelift, it will be natural, because as I explained before, and I explained again, the facial anatomy consists of 5 layers all over the face: skin, fat, and this is from superficial to deep, then muscle, then a space, ligament, nerve, and then the bone that the ligament sits on, or deep fascia. And then what happens with aging is the skin moves down, the fat moves down, the ligament weighs down, and everything kind of shifts down. So what you're doing with the facelift is you're going under the ligament, you're repairing the ligament, you're repairing the damage that's caused the aging, you're filling up areas that have lost volumes with fat, you're shifting volume around from instead of the jowl up here on the cheekbone, and then you're removing skin gently. So when I do a facelift, for example, once I do all the internal work and cut the excess skin, it's skin to skin. There's no tension on the wound at all. And that's one of the keys with someone who's a facelift plastic surgeon, is that there's no tension on the skin, so you're going to look natural. People that don't do a lot of facelifts or pull a lot on the skin, or there's a lot of non-plastic surgeon practitioners that maybe pull the skin too much, do a lot of thread lifts, then it can look overdone. So the answer is you will look natural, because it's not glamorization surgery, it's anti-aging. Now, there are some people that do glamorization surgery, which change the structure of the face and things like that, especially in Korea, but that's a completely different beast. So the answer is, but if you go to a reputable plastic surgeon that's got facelift training and an interest in facelifts, you're definitely not going to look unnatural at all. And you can just go to my website, artisteplasticsurgery.com.au, follow me on either my Facebook or Instagram. You'll see some before and afters with the patients that have let me consent to have them on. Most of them look very natural. And if you ever come and see me, I can show you a lot more photos as well. Okay, so that question hopefully is answered. Next question is, how long do the results of a facelift last? And how do I know the right time to get a facelift for me? Look, that's a great question. A short scar facelift will last 7 years for the jowl. A mini lift that I do in the office will probably last just 2 years, because I'm only operating there, not down here. So short scar, 7 years, about 7 years. A signature facelift, which is what most plastic surgeons do, lasts about probably 7 to 10, more pushing towards 10, 9 years. Now, celebrity facelift, high smash, I call it once in a lifetime, but the reality is it lasts 15, 20 years. So most people who get it at 55, 60, that's why I call it once in a lifetime, and that should last 15 years. The reason why it lasts a lot longer is you're actually cutting the smash internally this high, and you're actually peeling that internal part of the face, part of the neck as well, and you're really lifting it up with a lot of fat grafting, so it dramatically reverses the aging. It's basically like, instead of renovating the kitchen, if you look at signature facelift renovating the kitchen, so what you're doing is you're actually, say, just getting a new top, you're getting new modular drawers. When you're doing a high smash facelift, it's like a knockdown. You just knock down the kitchen, build a new one. That's why it lasts a lot longer, for that reason as well. In terms of the right time, look, it really depends what you want in life. Like the youngest patient I've done a facelift on, the circumstances are a lot of weight loss, a lot of loose skin. She was 37. That was the youngest. I have done a facelift on a 42-year-old for anti-aging. So that's what, it really depends what you want. I just got a question about that, Lisa. How much are you looking at for a celebrity facelift? I'll talk about costs in a minute. I will address that question, don't worry. But look, it's not cheap, obviously, because it's a 6-hour operation. So there's anesthetic fee as well as hospital fee. So, you're looking probably altogether around the 30 mark, probably, maybe a bit more as well. But anyway, that's why the treatment range is anywhere between 10 to 35,000 in terms of what facelift you have. But yeah, lost my train of thought there. The results of a facelift and when to get one. Yeah, so I've done it. The average age I've done a facelift on is about 53 if I really look at all of them. Or it might even be 61. I've got to look at the average age of my patients at Artiste Plastic Surgery at 43, which is a lot older because I tend to do older patients because I do more face stuff. And I think the average age of my facelifts around 53. I've just got to double check that again. Yep, I will talk about scarring in a sec. So it's up to you guys. So if you've got a little bit of gelling, you can have something done. So it's up to you when you want. Ideally, like as soon as you're thinking about it, the earlier you do a facelift, the younger you'll look. So it should shave 7 to 10 years off your life easily, in terms of, not off your life, but in terms of how old you look. You're still going to age the next 7 or 10 years. So if you had a facelift at 45, you could look like you're 40. And then when you're 50, you're still going to look like you're 40. Then if you have another touch-up facelift at 50, you'll look like you're still 40. And then when you're 60, you'll still look like you're 40. So when I was in New York, Cheryl Aston, who I work with, one of the doyens in plastic surgery, him and Dan Baker, he'd do a facelift on a patient 7 times every 5 or 6 years and just lift skin and do a little bit of smash. And the patient was 60 when I saw her and she still looked like she was 40. So it really depends. If you wait till you're 65, you can look like you're 55, which is great, and a good 55, but you can only look 10 years younger at the most. Whereas if you have a facelift at 55, you can look like you're in your 40s. So it really depends what you want and how much you're willing to invest. But you've got better skin when you're younger. And by reversing those early changes, you're actually correcting the cause of it. So you're really fixing the problem instead of just sweeping it under the carpet, which is a bit harsh, but is what you do with filler and every other modality. With regards to scarring, so with my facelift incisions, like I said, there's no tension on the wound. And I do a few tricks in terms of, if you guys, now, I don't want to tell this to the whole world because it's like a little trade secret, but if you guys get your finger and feel the skin behind your ear, it's really quite tight, like really tight. So good. Thanks, Angel. It's really tight, the skin, right? And one of the things I learned when I was overseas is, you just don't remove any skin there because it's so tight. Even in someone that's got loose skin, it's never loose there. And that's one of the keys with getting a really good scar, is basically not removing any skin there. And a lot of plastic surgeons that I trained with, certainly in Australia, and even when I saw overseas, because not all of them do this, remove skin there, but there's no need to remove skin. But anyway, that's a side note. So there's no tension on the skin, so straight away you're doing well. Then after 2 weeks, I use micropore tape over the area religiously for 6 weeks, as well as the facial compression garment, which will help everything stay intact. Then if I notice that maybe some of the scar's thickening for whatever reason, I don't waste any time. I just inject it with steroid. And then if there's still an issue, I use my Vivace radiofrequency needling, which will help the scar as well. But generally speaking, all I recommend is micropore tape. If that's not working, then I do steroid. I don't routinely use silicone. I don't think there's much evidence that it works in a facelift, but some patients do ask me, and you can use silicone. So you can use silicone tape from Sikacare. You can buy a big sheet, costs $80, and cut it to shape, and you can reuse it. Or you can use silicone ointments to rub over the area, and they're made, one of the companies is StrataMed or StrataDerm that make that. But generally speaking, I just do my technique, micropore tape. I usually needle the scar anyway, because they get a needling after the facelift as part of the facelift, and then I usually put micropore tape afterwards on that area, and then if necessary, steroid down the track. All right, excellent. 43 minutes, so I've got one question to go, unless you guys have more, so fire them now. Otherwise, that's it. No more Dr. JZ. Until next time, anyway. What compression garments do you use, and do we get them from you or somewhere else, and are they fitted? Great question. I do use a compression garment. So when I do a face and neck lift, and this is another thing that I do that's very, not controversial, but other people don't really do this, but I actually don't put any dressing on the face at all for the first night, especially if you've got a drain in, because the drain's going to work. And then what I do afterwards is let you go home with a drain, no dressing at all. Now, if you haven't got a drain because you're having a short scar facelift, I'll put a light dressing on for the first day, then you have a compression garment afterwards. But I usually start the compression garment after 5 days. And a compression garment, some garments, depends where you buy them from. If you buy them from a certain company, they're one size because they're Velcro in terms of tightening, so they're one size. But some you just measure the neck circumference, and they come in like a small, medium, large. We usually provide that for the patient. So what we normally do is just get the measurements and we take care of it for you, so you don't have to worry about getting it yourself. We often recommend getting 2, because the first time you put it on, sometimes it gets a bit blood stained. And then if you want to wash it, put it in a wash like any other garment. Then you want to have another one while you wait for that to go in a wash. And so we size that for you and organize it for you. Cool. So that's all pretty good questions on face and neck lift, which will probably be some good blog topics for me to blog about, which is good. So I hope you guys enjoyed that face and neck lift thing. Facelift's a passion of mine. Like, as I said, in New York, I trained with Cheryl Aston, who did the late Audrey Hepburn's facelift. Trained with Tim Martin, Garth Fisher, did a lot of celebrities, so I'm very fortunate to do that. And I've got a Parisian flavour as well. So you guys should definitely follow me on social media, on mainly Instagram, on Facebook, on Artis Plastic Surgery, and feel free to inbox me. And I do a Facebook Live on Fridays that you can ask questions as well on my Artis page. Another question from Trish. Awesome. Do you have packages for people traveling? Look, I mean, in terms of surgery, it's very difficult because you need to stay in town for at least a week to make sure everything goes okay. But I've certainly operated on patients from New Zealand and from interstate and from Perth, and they stay for a few days. So they just liaise their surgery. So I usually do a Zoom consult or a Skype consultation, then we get the surgery done. And we kind of pre-plan it, and they stay for about 3 to 5 days, depending on the type of surgery, after surgery. And I usually liaise with the plastic surgeon in the relevant state for follow-up, which I do quite often. So yeah, there is. So there's no specific packages for them, but I do try and tailor things for them. So I organise accommodation for them, and I've got a few guys that I know that run Airbnb management apartments. So you can basically stay in Airbnb in Piermont, in the city, in Sydney, or in Bondi Junction around where my clinic is. So either Bondi Junction or Piermont, which is just out of the city. And I've got two people I know that have Airbnbs specifically for these reasons, and I'll have my nurse go out to them as well while you're there. And I also got another friend or colleague that who has a meal delivery service that you can get meals, so you don't have to worry about while you post op for the first 2 or 3 days. So there are packages in terms of I look after the logistics of it and can arrange transport, accommodation, and food. I've got skin packages, which is a separate thing for that, but I guess you meant, Trish, packages for traveling to Sydney. So the answer is definitely. So we try and plan as much as we can. Zoom consultations, photos, if you're happy to send photos over a secure email, and the website's definitely secure, SSL grade security certificate on there, so all the emails are encrypted, which is obviously very important. And the email system that we use also is encrypted, so you can send it quite safely on email and also the website. And then what we do is I can organise accommodation, organise transport, even food if necessary. So yeah, there's no actual packages listed on the website, but we take care of all of that. Cool, so I hope you guys enjoyed, and don't forget to follow me. Thank you, Trish, for having me on your great forum. And if you have any more questions after this or comes up, just let me know, Trish, and I'll email you back an answer, or I can you can even inbox me at Artis Plastic Surgery. I'll probably be on it tomorrow during the mornings, and I can get back to you guys. But thanks for tuning in, and I hope you guys have a great Tuesday evening. See you guys.